Hi, my name's Manoj Krishna. I'm a spinal surgeon. I work at the University Hospital of North Tees in Stockton-on-Tees in England. And this is my colleague, Tony Nargol. He's also an orthopedic surgeon, and he specializes in hip and knee surgery. Tony's going to tell us a story about his back problem, and then we're going to talk to him about his training. He actually trained in spinal surgery, and it'll give us some idea of how spinal surgery has changed over the years. So Tony, tell us about your back problem and how and when it started.
Well, it started about 9 months ago. I was at the British Hip Society presenting a paper. We got an award at the meeting, went up to collect it, and then started developing pain in the hip, and then quickly pain down the leg. I thought it was a bit of a joke being at the British Hip Society developing hip pain, but then it became obvious on the train on the way home that this was more than a hip problem and was full-going sciatica. Got home, struggled along. Somehow I got to see you. You performed an MRI scan, had a disc prolapse and some bone also pressing on another nerve. And then it got worse, and then you performed an epidural. And I remember saying to you, look, I've got a lot of work to come up in the next month at work. Whatever you do, I need to keep working. And you gave us an epidural, and it was like a magical effect. And through the hard sort of lists and operating lists I had, you kept me going, and I got everything done in that month. But then a couple of months later, it slowly deteriorated. And then one morning I woke up and I couldn't walk. I couldn't get out of bed, I couldn't get to the toilet. And I remember ringing you and saying, Manoj, what do I do now? I can't get to the bathroom. And you suggested crawling. And so I got on my hands and knees, I slid off the edge of the bed, down on my hands and knees, and it was great. I could crawl to the bathroom, crawl up onto the toilet, and then crawl back into my bed. And I found I got really good at crawling, and I could go up and down the stairs on all fours, go around the house, and that was fine for a day or two.
Well, you used your son's
well, that's right.
Pads.
Shin pads, yes, because after a couple of days my knees started to get sore, and so then I got his skateboarding pads, put them on my knees, and I could get around the house. But clearly as a orthopedic surgeon, I wasn't much used to my patients being able to crawl and do nothing else. And that's when we saw you again and had further tests or scans. And that's when you made the decision to perform surgery on me, which you can describe later. But it was the point where I didn't really have any choice. I was worried about my career. I'm 44. A lot of time ahead of me, and my concern then was not only would I get rid of the pain, would I be able to work again? And that was the big concern, because having 5 children, a mortgage, you suddenly worry about the rest of your life. And I thought long and hard about the operation, but I really, in the end, I was just glad to get rid of the pain. I remember you had me on morphine and crawling on morphine, and that's all I could do.
I remember when you came to see me, and we were talking about surgery, and I was sharing with you, well, I didn't share with you then, but maybe afterwards, how daunting it is sometimes to operate on colleagues. Yeah. Because you feel, your reputation is at stake, and I tried to dissuade you and said, Tony, there's a lot of nice spine surgeons in the area, all the way from Newcastle down to Leeds. Take your pick.
Well, yeah. The trouble is, having worked in the region and having been a researcher in spines many, many years ago, I felt more confident in yourself than anybody that I know in the region, if not in the country. And that's after working in most of the hospitals in this area. And I know that you've been a great believer that the source of the problem in the back is from the disc, and if you identify that and if that needs treating, you've got to perform the correct operation. In fact, before we made the decision for surgery, I actually Googled PLIF to say, well, what are the results for this? Will I be able to do my job afterwards? And I looked at some results and I thought, this is pretty good. It came up on Google, the first sort of name that came up. And then I thought, well, which surgeon is it that's done all these PLIFs? And it was yourself.
Right.
So I thought that gave me some sort of comfort. And then I looked into it a bit further and realized that you'd done the most PLIFs through this sort of small approach than anybody in the world. And as I say to my patients for hips and knees, go to the guy that's done the most, who knows all about it, and that's why I felt confident.
Okay, so tell us about the surgery and
Well, it was strange coming into my own, if I use the expression, my own ward, where I'm usually on the treating side of patients. But the staff were great. Went down to theatre. Your anaesthetist gave us a spinal as well as a GA, and that was very smooth. And it just went smoothly. Woke up, recovery, pain immediately down the leg had gone. That was when I realised this is going to work. I just knew immediately this is different. And the problems I had previously was I used to, if I roll over in bed, I used to get pain. Getting out of a chair was agony and would take me a few minutes. And immediately, even in recovery, I could half roll and feel the pain's gone. And I knew that that was going to be good. And the first night was quite comfortable. I was expecting to have more pain than I did. It to me looked less painful than having a knee replacement. So you got me to walk down the ward, which was a surprise. But the pain had gone, and I could walk. Having up until that point been crawling, I could walk half the distance of the ward the morning after surgery. I was amazed. And the pain was considerably better. It was a little sore from surgery, but nothing like before. And I went home. I hardly took any painkillers. And obviously you're tired after the operation, but within a week I felt tremendous. And you did exactly what I wanted, which was that operation, I think, was the beginning of July, and I got back to doing quite a large number of hip and knee replacements in July.
Wow.
And that
So
was
what,
my
3-4 weeks?
Less than 3 weeks.
Wow.
It was also a question of need. I had to get up there and do the work, and I achieved that.
I mean, you surpassed both your and my expectations in terms of how quickly you got back to surgery.
In addition, I also went on holiday to Mallorca in that 3-week period as well. I came back and then did the joint replacements. And I sat in a bus for 2 hours in Mallorca, travelled over there in the plane. That was fine. That was about 2 weeks after surgery. And came back, did some operating lists. The improvement continued. And then about 6 weeks after surgery, there was a cricket match between the doctors up at near Wynyard, and I took my sons to play, and they were short, and I happened to have my kit in the car, and I just couldn't resist putting it on and joining in.